If you're struggling with scar tissue and you feel just really stiff when you're moving, try this pin and stretch technique. Pin and stretch is really unique in that it helps to break up scar tissue while also improving movement. Some of the other scar tissue techniques are a little bit more static. This one is really great for improving some of your dynamic motion. So we're going to be addressing the connective tissue, addressing the scar tissue, and we're also going to be improving your movement. Okay, so what happens is that when a muscle contracts and relaxes, it needs to be able to kind of move in a certain pattern, right? A certain orientation. So say my bicep, for example, right? When I contract this bicep, it's moving in this motion here where the fibers then are oriented in this vertical fashion. What happens though sometimes is that when we have scar tissue, say especially down in through this bicep tendon, that connective tissue is no longer moving how it's supposed to. And also some of the muscle fibers themselves, they have connective tissue around them. Sometimes they're not moving well. So what we can do is we can do something where we hold down an area that might be adhesed as we're moving the joint through a certain range of motion. Now, the thing is that you need to know that where it is you're targeting, right? So if I'm targeting my bicep passes the elbow joint and the shoulder joint. So if I want to improve my bicep flexibility, then I should do something where I'm moving my shoulder and then another one that I'm moving my elbow. Okay, so you need to know if you're trying to be effective in terms of what it is that you're trying to target, you need to make sure that you're targeting that muscle or that area that crosses that respective joint. The most important thing is that you want to target the muscle and the connective tissue, not the skin. Okay, so if you remember anything from this video, it's this, that you need to make sure that you get to the area of the muscle and the connective tissue, not the skin. Okay, so I need to kind of press into this skin in order to be able to get to that part of the muscle. And you'll feel it, it might even feel tender. So I just wanna press in through here, and then I'm just gonna hold this whole time as I bend and straighten my elbow. Because here, I'm getting the bicep to contract, but I'm holding down the connective tissue, the scar tissue, as I'm moving my elbow through a range of motion. You might find you have less range once you hold down that area. That's okay. So just move through whatever range you can. So then you're going to go back and forth 10 times, just like that. Then you're going to find another area, do the same thing, back and forth 10 times. You can even add a little bit of weight to this too, in order to apply a little bit more resistance, which might be more helpful in terms of just like kind of getting that muscle to contract. So you're just going to go back and forth. I would choose something like 3 to 5 different areas along a muscle just to get that to move a little bit better. One way that I do this a lot is for the knee. If they've had some type of surgery or they've had patellar tendonitis for an extended period of time, this is one that I'll do really frequently. So if you're doing this yourself, you can use both thumbs and you just press down. Remember, we're not going on the skin. You're pressing down and you're going to bend and straighten that knee. So I'm just holding in that one area. It's especially useful to do right around that kneecap area, because here's where a lot of times there ends up being a little bit more of that connective tissue that gets kind of stuck. Another way though that you can do this is you're going to actually kind of move across the skin. But here's the thing, right? You know how I said that you want to make sure you're not targeting just the skin. So you need to first press in enough. So you're going to press into that tendon, and then I'm going to pull up as I straighten my knee and then come back down. Then I'll do the same thing. I'll press in and then I'll pull up as I straighten that knee. Okay, I want to try to do 3 sets of 10 of that active range of motion. And you can choose those 3 to 5 different areas where you go through that active range of motion. Be careful though with not moving that joint through too much motion though. So you might want to limit it to 5 repetitions on each side, or only choose 3 different areas that you do this. Another key point is making sure that you're consistent with this. So you need to do this about at least 5 times a week. You can even do it daily, and you need to do it for a 4 to 6 week period in order to really get that connective tissue to remodel in the most effective way. when we break up this scar tissue, what we're trying to do is we're trying to get what's called a histologic response, right? We're trying to get a response from the tissue to remodel, to reshape itself. So if those fibers have been all kind of bunched up like this, what we need to do is we need to get them to be organized like this. That doesn't happen in one session. It doesn't even happen in a week. It needs an extended period of time, because what you're doing is you're rebuilding the structure of the actual tissue itself. That takes a 4 to 6 week period, because it has to undergo what we call remodeling, right? So it's like building an addition on your house, right? Like the way that I describe it sometimes is that when we try to create some of these changes, we can do something where it's almost like we're kind of like decluttering our house, right? Like it might look a little bit more organized, and then you might feel like after 1 or 2 sessions of doing some of the scar tissue work that it feels a little bit better. But in order for it to actually be different, what we need is we need to remodel, right? We need to actually like do a makeover of the connective tissue and of some of those muscle fibers in order for it to actually be a change, right? So we go from just decluttering your house to make it feel like you have more space to actually building an addition. It's kind of the same thing. You might find that after doing some of this work that, oh, it feels better for a little bit, right? But the thing though is that that's just decluttering. What we need to do is we need to build the addition, right? So that's going to take a little bit of time. It's going to take that 4 to 6 week period in order to actually change the structure of the connective tissue. So try to be patient, and most importantly, be consistent.